welcome back to my channel. So today I just wanted to give y'all an update on my nursing career, I guess, so far. It's crazy. It's July now, so it's already almost been a year since I've graduated college, nursing school, all of that, which is crazy. So let's see, looking for my notes. Those of y'all that have been subscribed to my channel and following my journey for a while, then you know I graduated nursing school in August of 2018, and I've been working as a mother baby nurse since September. Yeah, I started my nurse residency in September of 2018, and then we started our preceptorship, so actually being on the floor in the hospital in the end of November. It was right around Thanksgiving. So yeah, let's see, that would make okay, so yeah, so I've started about exactly 9 months ago, and then I've been on the floor for 8 months, and then my last week of preceptorship was the very first week of October. So I've been on my own as a nurse for 5 months, and for about 4 months I worked on night shift, and just recently in the past couple weeks, or almost a month now, I switched to day shift. So yeah, in total I've been a nurse for 9 months, closer to 10 now, because I feel is the year almost up? I mean, the month almost over? I don't know, but yeah, it's been a short time. It's really crazy to me that it's already been almost a year, and yeah, I know at a year we get a bonus just for having been, employed for a year. And yeah, my plan in my head is to kind of keep working. I can't remember if I said this just now, but I'm a mother baby nurse, or postpartum. So the reason why people call it different things is because before it was they didn't do couplet care. So there were postpartum nurses, which took care of moms, and there were nursery nurses, which took care of babies. Now it's together and they call it mother baby. Some people argue that. Sometimes they say PPU, sometimes they say MBU. It just, whatever. But if you're ever curious, curious at the difference or why people say different things, that's why. So we've moved on to couplet care. It's more baby friendly, and just, times have changed. We're no longer in the days where you have your baby and then your baby goes to the nursery in a separate room and you just chill in your room and recover without the baby. We do still have a nursery, but we promote rooming in, especially for breastfeeding and just, in general. It helps with your getting to know the baby, getting to know your feeding cues, yada, yada, yada. So sometimes people, especially older people, get to our unit and they're like, oh, this isn't how it used to be, and it's not. So yeah, things have changed. I know some facilities don't even use their old nurseries anymore, but yeah, we do. It's just not full time or anything. And what else? Yeah, I mean, my job, I like my job. Y'all know I originally wanted to do labor and delivery, and I'm still leaning towards that. So I'm hoping, in my head I want to stay at my job about 2 years. That's how long my contract is for my residency, but they have a thing now, a bridge program. So hopefully this time next year you have to have 16 or 18 months or something of experience. So this time next year, I'll be able to do that and kind of get cross-trained to labor and delivery in our hospital. So that is where my head is right now. I do like mother baby. I enjoy working with the babies, working with the moms too. It's nice because it's probably one of the most happiest part of a hospital that you'll ever find. So typically people are in the hospital because it's the worst day of their life, but on our unit they're here to have a baby, so it's a pleasant experience for the most part. Yeah, sometimes small things go wrong, babies might need their bilirubin levels could come back high, and they need the what do you call them? Crap, the bilirubin lights, the bank lights, phototherapy, or something small like that. Sometimes we do transfer babies to the NICU. I've transferred 2 so far. One of them should have been transferred long before I got there, let me just add. But for the most part, it's half the time. Occasionally moms, I did have to transfer one mom to like a higher level of care just because so like I still haven't even got a chance to look more into it, but like PIH or preeclampsia and stuff, I feel like they kind of make it seem in nursing school like it's only something that happens during pregnancy and then the cure is delivering the baby, which yes, but it can also happen after. So that was my case when I had to transfer one of my patients to a higher level of care. But yeah, just lost my train of thought. But I like it. Oh, versus we don't get many, you know, fetal demises. Of course, obviously, if the baby is passed, we would not get the baby. Sometimes I've heard of a couple times us having the mom and the baby being in NICU and the baby in NICU passing away. But for the most part, we don't. It's a very happy place on our unit. I do, yeah, like I think I really like what I do. My hospital though does have, you know, some systemic, you know, just errors and just things that aren't quite organized properly. But I mean, in my head, like lots of people complain about it at work, and some people that have worked at for other hospitals are like, you know, this is one of the least organized places, and I just feel like the grass always seems greener from the other side. I'm sure these other hospitals, like I've heard about some of the other like top hospitals in our area, the medical center, they're like, they micromanage. You have to scan out formula. You have to scan out like diapers, like from the Pyxis. So it's like, versus my hospital, and I don't mean lenient in the sense of like we do whatever we want, but people aren't sitting there micromanaging your every move. Like I can give my patients some formula. Like no one is bothering. We can have our phones out, which obviously no, we don't get much time to have them out, but if you do, if you need to take a call, if you see something funny, I like thought one of my babies looked like this cartoon character in a really cute way, and my manager, I'm like, let me show y'all what I'm talking about. Like it's like, you know, it's chill, it's more low-key, it's not like everyone's sitting there all crazy. But on my floor, we can have up to 8 patients, which a mom counts as a patient and a baby counts as a patient. So we usually have 4 couplets, but we can have just a mom or just a baby. Some moms, like I said, their babies are in NICU, and then sometimes we can get, if the mom is in higher care, like some moms, they stay on the antepartum unit and then they deliver and they go back to the antepartum unit. Whether like when I had to transfer that mom, I transferred her to the antepartum unit. We also have part of our unit has like an intermediate care type of unit, so it's still just postpartum moms, but it's the ones who are, you know, requiring lots of medications and like constant monitoring and stuff. But in that case, those nurses are only going to take care of the mom, and I think they only have 2 or 3 patients or something. So we can just take care of the baby. So lately, summer is apparently a really busy time, so we've been coming in on 8 patients. Staffing is an issue. So yeah, there's been a lot of just stuff everywhere, but I really don't want this video to be too long. I like my job. I haven't experienced too much of like nurses eating their young. Everyone on my unit is really nice, and just I never feel, which it could just be me, like I'm gonna get the help that I need regardless personally, but no one, I feel comfortable going up to almost anyone and saying, hey, what do I do for this, what do I do for that? Some stuff we don't do often. Like I just gave Rogam for the first time in what, I've been on the floor 9 months, and just gave Rogam for the first time 2 weeks ago, and then I had to give it again the next week, and I was able to do it on my own and like remember what another nurse had shown me the day before. And I just switched from night shifts to day shifts, and everyone was super welcoming. It is funny, everyone's like, hey, what are you doing here? Like thinking I'm staying over late from the night shift, but it's like, no, I'm on this shift now. And just, yeah, it's a lot different. I'll definitely do a video on just the differences. And there is, you know, that whole nights versus days stigma, which I feel like is just everywhere. But all in all, I mean, it's been going well. Summers are really busy times. So I've personally been working extra, like I'll do like one extra shift a week, just because, you know, it counts as overtime per week, not per 2 weeks. And from talking to one of my charge nurses, she explained that just, you know, the way the taxes and stuff, you end up getting paid more if you do like 4 days and 4 days, like 4 days this week, 4 days next week, versus doing like 6 days 1 week. Like, because those extra, after that one extra shift, any extra that you do, a lot of taxes end up coming out of it. So I've been doing that, and like I just paid off my car a couple days ago, and like I have lots of vacation next month. Like my PTO started accruing like immediately. So it is nice, you know, being able to, my schedule isn't that bad to where I'm liking day shift, like I'm awake right now. So hopefully I can get more consistent with my channel now that I'm more normal. And yeah, it's just, I like it. I feel it's crazy. It's already been a year. So, I mean, comment, let me know what y'all think, any questions y'all have. Thanks for supporting me. I feel so like just inspired and just happy and grateful every time I see a little notification that somebody subscribed to my channel, especially when I like don't post as often as I should, or I feel like I should. So it's just crazy that y'all still support and still watch the videos that I do have and comment, and it means the world to me. So thank you so much. Yeah, I'll see y'all in the next video. I'm gonna go for 1 a week for now. Yeah, let me know what other things y'all like to see. Like my nursing videos do really well, but I am into like fitness and stuff. I like fixed my camera and stuff, so I could do some vlogging with all my travels and my birthday coming up and things like that. So just let me know what y'all want to see, and I will do my best to do what y'all want for the most part, within moderation. So yeah, don't forget to like, comment, subscribe, and share this video. And